All right. Hello, everyone. Happy Wednesday, and welcome to the latest installment of the Cosmetic Laser Dermatology webinar series. I am very excited. We are here today with not just one, but two amazing experts. We have Dr. Mitchel Goldman. Hi, Dr. Goldman.
Hi, guys. Thank you for taking time out of your day to be watching this.
And we have Leysin Fletcher, our amazing physician assistant. Hi, Leysin.
Hi, everyone.
So today, Dr. Goldman and Leysin are going to be talking about Cool3, which is our proprietary treatment found only at Cosmetic Laser Dermatology for body contouring. And they are going to tell you all about it, what it's about, and there is a special discount code that we're going to be giving during this webinar. So please stay tuned. Without further ado, Dr. Mitchel Goldman is the medical director for Cosmetic Laser Dermatology. He is a board certified dermatologist with decades of experience, and Leysin is our esteemed physician assistant. She's been with the practice for a long time now. How many years, Leysin?
13 and a half years.
Wow. And we're very lucky to have her. She is a master CoolSculpting specialist, which is a very special certification that only goes to very select people. And we're really excited to share everything about Cool3 with you today. So take it away, Dr. Goldman and Leysin.
Okay, so I'm going to start off a little bit. This is the agenda. So you're going to learn a little bit about us and about our CoolSculpting Cool3 technique, as well as how to actually schedule your appointment. This is our whole team. So even though Leysin is our world famous expert in CoolSculpting, and most of the CoolSculpting we do in our office is under Leysin's supervision, we have a number of incredible doctors. You can see me with the bald head on the bottom, and then Dr. Butterick, who's been with me for 33 years. And then going from your right to left, it would be the famous Dr. Wu, Dr. Groff, there's Leysin, Dr. Fabi, and Dr. Bowen. So there's a lot of us here at Cosmetic Laser Dermatology. One of the things that's really good about our practice is not only are we pretty well-known dermatologists, we do a lot of incredible work with breakthroughs in science and rejuvenation and medicine. Because what we always want to do is make sure that all of our patients get the best treatment possible. And the reason we're different than some of the other medi-spas and other places that do just CoolSculpting alone is we do everything. We do all of the different body sculpting procedures, including liposuction and injectables. So we know what is the best procedure to do. You know, part of the thing is we have Leysin. And Leysin, as you can see, is an incredibly talented person with incredible 13-year-and-a-half experience at cosmetic dermatology. I'm the old guy on the block. I've been around for a long time, practicing now for 35 years. And I'm the medical director of both West Dermatology and Cosmetic Dermatology. And so, you know, I tend to sort of fool around with many different cosmetic procedures. But the best thing that I've done is train other people that actually become better than me. And that's probably the best thing any kind of a teacher could say. So CoolSculpting is what we're going to talk about today. But like what I alluded to, we do more than just CoolSculpting. And so unlike other kind of medi-spas that only do CoolSculpting, and so they're going to use CoolSculpting for everyone that comes in, we'll be able to choose the most appropriate treatment for you. Many times it is CoolSculpting, but sometimes when our patients come in, it might be another procedure, like a liposculpture, a thermotite, or something of that sort. And so when you're in our office, you're not just going to be pushed into the only treatment that we have, but you're going to be able to take and to evaluate all of the different treatments we have so that you can choose the best treatment for you. And this is what CoolSculpting basically is. It's a very easy way to freeze and melt your fat. And so what it does is we can't get rid of fat underneath the muscles, so the beer belly type of fat. but we can get rid of the visible fat reduction. And that's what you can pinch. So if you can pinch a few inches of fat, that can be frozen with CoolSculpting. You see here that this patient, there are two CoolSculpting machines, and that's called dual sculpting. And we do that as well because we have all of the latest technology from Allergan's CoolSculpting division. We know that CoolSculpting has now been performed for over 9 years, and the results tend to last for 9 years. So once the fat goes away, we do not see the fat come back in the same area. Of course, if you like pig out and gain a ton of weight, you're going to develop fat in other areas, and then we'll CoolSculpt it away for you. So no real problem. Now, how did this all start? Well, it started at Harvard, and basically two of my good friends, Dieter Manstein and Rox Anderson, observed that when kids would be sucking on popsicles, they basically eliminated the fat in their cheek, and they got like dimples. And that was called popsicle panniculitis. It basically means a cooling of the fat. And they figured out that, hey, if popsicles could do this, then what could we do by cooling the skin? And so they worked with a bunch of talented engineers in order to actually produce a very safe and effective way to freeze fat like a popsicle and have your body resorb it. And this is essentially what happens. So this is the science, and it's a busy screen, so there's a lot of stuff on here, but let me take you through it. It's really a cool science, and I really like that term. What you can see is, you can see that here is the skin. This would be the layer of the skin, like the dermis where collagen and stuff is. Here's your fat, and then here's your muscle. And what happens is the fat is frozen by this machine, causing its destruction, and then the fat cells are eliminated. So any of these blue cells that are destroyed fat cells get resorbed by the body, and you can see that when you have maybe a few inches of fat, now you have much less. And usually the CoolSculpting procedure can get rid of an inch or two of fat in one session. Sometimes patients require additional sessions in order to get the area to be as good as you would like it to be. And so we're basically eliminating fat a little bit at a time. Now the FDA has cleared 9 body areas, and we actually can do even more of these body areas, but this is what's been cleared by the FDA under the chin and jawline, the back, the abdomen, the inner and outer thighs, and then the flanks, which is really a good one to do, arm fat, and even that bra fat that I call the wings. So how does this fat actually go away? Well, what happens is the fat's absorbed into your body, just like if you ate, you can see here a plate of French fries. And the fat is processed the way our bodies always process fat, through the liver, and then it's basically either most likely pooped out. And so that's essentially what happens. And it happens incredibly safely. So when we've done multiple studies where we actually measure the amount of fat in your bloodstream, there's basically the same amount of fat is processed as eating like, or even less than like a Big Mac. So it's very, very safe. You don't develop fatty liver. You don't develop atherosclerosis. The fat is just gently resorbed and literally pooped out of the body. So very, very simple way, very, very safe. Literally millions of patients have been treated with no adverse effects. This just shows in a cartoon style sort of what happens. So you can see that the fat cells, as they shrink in volume, basically we're recontouring you. So instead of having like love handles over here and sort of bulging inner thighs or saddlebags on the outer thighs, the fat, just like you would do when you were dieting, the fat cells literally disappeared. And so we target the fat cells with the CoolSculpting apparatus, and that basically destroys them, having fewer fat cells, which actually do not grow back. So once we destroy the fat cells, they do not come back. This is what you can expect on your treatment day. And Leysin, I'd like you to sort of tell our audience what usually patients will expect.
Absolutely. So typically what I like to do on the treatment day is to review our treatment plan and come up with your number one or number two areas of concern that you're interested in starting with. It's best to start with your top area or top two areas so that we can treat those specific areas to completion. So what we do is we have a nice full-length mirror in our exam room or treatment room, and you and I together will actually review the areas of concern, and I will mark those areas of concern, and you will have the chance to confirm in the mirror that those are in fact your stubborn areas that you're wishing to treat. And then we are able to come up with the treatment plan and apply the applicators that day.
And you can see that the patient is basically just relaxing. Now, this patient is just undergoing one treatment area, but most often we will treat both treatment areas at the same time. And this just shows a picture of how the suction cup is painlessly applied to the skin. So what you can expect after treatment is that if you're maintaining your weight with normal diet and exercise, you're going to have a shrinkage of fat. And most of our patients see results after just one session. But as Leysin pointed out, we like to treat to completion, which we will tell you in advance how many treatments you probably will need in order to get the desired results or the results that you would like to do. And Leysin, why don't you talk about some of the before and after pictures that we're seeing?
So this patient here, you can see before, and then this is 6 weeks after CoolSculpting. Over to the left of your screen, you'll see the treatment plan where the patient was customized to 4 separate applications to treat her entire abdomen. The fact that our office has 2 machines, we're able to treat 2 areas at once. So a treatment such as this would really only take 70 minutes to do. This is one of my patients that I treated actually. And she had one Cool Advantage Plus applicator to her lower abdomen. And then she came back 6 weeks later and she did her upper abdomen, 2 small applicators to her upper abdomen. And then this is the photo on the left is 2 months post her second treatment. So she wanted to treat her abdomen separately, her lower abdomen first and her upper abdomen second. But it's very easy to treat them both on the same day. And this is my patient as well. And she did her lower abdomen and upper abdomen. She had 4 applications, 2 to the lower abdomen and 2 to the upper abdomen. She repeated that twice. And the photo, the post 2 months is after 2 treatments to her abdomen.
What's impressive to me is you actually can see, you can see her lines again. It's like you can see her abdominal muscles, the rectus abdominis. So without doing tons of push-ups or sit-ups, she actually has, you can finally see how pretty her muscles are underneath. Now, Leysin, tell us about this patient because she was a bit older.
Yes, this lady, she is a lovely, lovely lady. She actually happened to be 85 years old. She came in for a consultation desiring to look better in her clothes. She said, I want nothing more than to look better in my clothes. And so we came up with a treatment plan for her, and she did 2 treatments to her abdomen and flanks. So we did 2 to the lower abdomen, 2 to the upper abdomen, and then we did 4 to the flanks. So the anterior and posterior flanks. 6 weeks later, we repeated the same treatment, 2 to her lower abdomen, 2 to her upper abdomen, and then 2 to the foot and 2 to the back of her flanks. And you can see the photo post 6 months after her second treatment. She was thrilled. She was almost in tears how happy she was with her results.
I know, and the best part about this is she actually was my patient, and I sent her to Leysin, who just did an amazing job. And this is without diet and exercise. She just wanted to look really good in her clothes. And I think she lost like 2 dress sizes. So she was a very happy person. The other thing you can see is even though she was in her 80s and you could see that her skin is very flaccid, it tightened up. So part of the process with CoolSculpting is when the fat cells are being resorbed, there's a mild amount of inflammation that actually causes some contraction. And so even in this elderly patient with very lax skin and a lot of fat, you can see dramatic tightening of the skin at the same time. Let's go to a younger patient.
So this is a patient of Dr. Graf's, and she actually had 4 small applications to the abdomen. So she did 2 to the lower and 2 to the upper, and this was 3 months after her second treatment, and she was very thrilled with her results as well. And this patient here, she had her lower abdomen. We used Cool Advantage Plus to her lower abdomen, and then 2 Cool Advantage applications to her upper abdomen. And she had 2 treatments as well.
Again, on this photograph, again, you can see that she had pretty lax skin that tightens up over time. And this also shows you that CoolSculpting can be used on any skin type, whether you're Caucasian, Asian, Latino, African-American. CoolSculpting does not know anything about races because fat cells are the same underneath all of us.
And this patient actually had her abdomen and flanks done, and she had 2 applications to the lower abdomen and 2 to the upper abdomen, and then she had 1 on each flank.
Yeah, just beautiful results, Leysin. So Leysin, talk us through how we would treat patients to completion.
So typically, CoolSculpting should be considered a journey. Due to the non-invasive nature of the procedure, it is important to know going in that you'll need to do more than 1 treatment to achieve optimal results, which is why we like to have our patients first area of concern and treat that area, 2, possibly 3 times to get those wow results, and then move on to the next area of concern. So these patients here, these are a couple treatment plans, had abdomen and flanks done. And this patient on the left of this, or the right of the screen, actually had 2 small applications to the lower abdomen and 2 small applications to the upper abdomen. And then this was her result 23 weeks after her CoolSculpting session. Now the patient on the left had 6 applications. And oftentimes when you have a longer torso, we kind of get that subcutaneous tissue over our ribs. So it's very important that you come in for a customizable treatment plan so that we can treat you appropriately according to those areas. Some people require 4 applications, some people need 6. As you can see, this patient on the left, they treated the lower, the mid, and the upper over the ribs to make her give her her optimal result. And the patient here on the right had, it looks like her lower abdomen treated. So they did 2 small applications to her lower abdomen. And then the patient on the left had her flanks treated, and they did upper and lower flanks. So a total of 4 applications. These are some other areas before and after treatment. So we like to see our patients back 6 weeks after treatment to kind of reassess, because you will see a circumferential reduction after 6 weeks time. And that's when we like to reassess for the second treatment. So this patient in the photo here has had 4 applications, the first treatment, and then she had 4 6 weeks later, and then 4 weeks after her second session, you can see she had a very nice result.
Yeah, really nice results.
And this patient had her flanks done, and you can see that she is just, it's given her that nice contour. She had 1 treatment actually, so she responded very well. These are some other treatment plans for flanks. As you can see, the patient on the right had upper and lower flanks, and the patient on the left had upper and lower flanks. 10 weeks after on the right, and then 6 weeks after on the left. Nice results here as well. These are abdomen and flank treatment plans. So the patient on the right had her abdomen, lower abdomen treated, and then the patient on the left had her 2 applications to her upper flanks and 2 to her lower flanks. So you can see how everybody's body is a little bit different. This patient was bothered by the love handles hanging over his jeans. He actually came in his favorite pair of jeans and asked me if I could help do something about this to make his jeans fit nicer. We did 2 treatments to his love handles, 6 weeks apart, and this is 2 months after his second treatment, and he was very happy with his results.
Yeah, and being a guy, I know that this is something that a lot of guys love to do, and I've actually had it done too, but that's another story.
So these are some treatment plans as well, based on areas of concern. And the patient on the right had 2 treatments to the lower abdomen, 2 applications twice, 2 applications to the lower abdomen on the right, and then 15 weeks after the second CoolSculpting session, there's the results there. The flanks in the treatment on the left, just 2 treatment applications twice, so a total of 4 cups each treatment, and then 13 weeks later, seeing nice visible results. So the outer thighs and inner thighs are another area that are nice to treat. So you can see the patient, the patient on the right here actually had her outer and inner thighs treated. And at our practice, it isn't FDA approved, but I like to treat the banana rolls. And patients really see a nice improvement of their thighs when we can actually treat inner and outer thighs and banana roll. It really does improve the appearance of the legs and bottom area. So we have this patient, speaking of the banana roll, here's our banana roll picture as well. So this patient had 2 applications across each side of her banana roll, and very nice reduction of subcutaneous tissue there. Under the chin is a very common area to treat as well. We use a very tiny applicator. Oftentimes we do like to use more than one, because if you treat along the jawline, you can not only get rid of some of the fat, but you can get some mild tissue contraction, as Dr. Goldman mentioned earlier. The combination of the cool and the heat can tighten the skin and give you a nice definition along the jawline. This is one of my patients that had her chin area treated. We actually used 1 application right under her chin. She did it twice, 1 month apart, and she was very happy with her results. And there's under the chin photos again.
Yeah, so many people that have this sort of fat, collection of fat or waddle under here, if you just get rid of that, it makes them look like they have a beautiful jawline, and it makes them look like they've lost a lot of weight. So treating the neck fat or the underneath the chin fat is one of my favorite areas to do. Very easy.
The bra fat is an area that bothers a lot of my patients. Just wearing dresses, being here in Southern California and having that overhang or the wings, like Dr. Goldman said. CoolSculpting works very nicely to help minimize and really get rid of those areas as well. The back fat is another very common area of concern. You can see after just 4 applications, this patient really slimmed down in the back area. So I'm sure her exercise tops and sports bras fit a lot nicer. The arms are a wonderful area to treat as well, and they actually happen to be a hyper-responsive area to treat. Oftentimes, a single treatment in the arms will really achieve a lot. So this patient here, it's after 1 treatment session, 11 weeks out. We usually will treat all the way along the upper arm if necessary, but again, it's nice to assess the area and we can come up with a customized treatment plan for you. This is my patient's upper arms. She had one treatment. She had beautiful results 7 weeks after.
So in addition to CoolSculpting, what we do, and part of what we call our Cool 3 treatment, is we use another device made by Allergan called CoolTone. And I've had this one done as well. What the CoolTone is, it basically is a way to stimulate your muscles to be firmer and more defined. And it's almost like doing, 20,000 sit-ups in 20 minutes. You really feel it when you're doing it. It's not painful, but you know you're getting an incredible workout. And within a few treatments, you really feel that your abdomen, the glutes, the thighs, whichever area we're treating, becomes firmer. When you're treating the abdomen, you also get your core stimulated as well. And so since I'm a cyclist, when I have my abdomen treated with the CoolTone, it's really giving me core strength as well. Other people, like my wife, likes to have her buttocks muscles treated because that gives you actually a raise in the buttocks and even your anterior thighs. So the CoolTone is a way that we can basically firm up and stimulate your muscles so that after we cool away or melt away the fat, we then stimulate your muscles that provide even further improvement. Now, in addition to basically stimulating the muscle, what we found is the CoolTone also helps to dissolve fat. Even though it doesn't do it as well as CoolSculpting, it also targets the fat as well. And so we find that in addition to making your muscles toned and harder, it basically helps with the treatment of our CoolSculpting. And we usually will do both in our patients. The way it's done is basically we put the applicator directly over the targeted area. It's a 30-minute session, and you really feel some strong muscle contractions. And Leysin, talk us through some of the patients.
So this patient here had a series of CoolTone to the abdomen. She had 4 treatments, and then this is a week after her 4th treatment. You can see this strength or the definition of the muscle. And this gentleman here actually had another series of 4 treatments to the abdomen, and you can really see it brought out some nice definition in his abdomen. Again, this is another treatment, abdomen, 10 days after the 4th treatment.
Yeah, and I think you also see an improvement in the fat. What you can't see on pictures, again, is how much your core is actually strengthened. So almost every one of my patients that does this procedure, many of them who are my friends that I cycle with, will notice that they're able to do planks for longer and cycle better as well. And you can see here, it's a perfect treatment, not only for women, but for guys as well, because you're really stimulating those muscles, getting that really chiseled contour. So what is this Cool 3? Because we now want to talk about the third part. So the third part, which really is our proprietary method that I don't think anyone else in Southern California is doing, is in addition to the CoolSculpting machine here and the CoolTone machine here, we then use a machine called the Z-Wave. And the Z-Wave is a radial pulse technology that delivers shock waves to the fat cells. And what that does is it makes all of the treatments work even better. And so here you see the CoolSculpting machine, as well as our CoolTone. And then here is the wonderful Leysin posing almost in a model style, very nice, with our CoolSculpting. And here is the Zimmer unit. Now you can see that we have a beautiful room with a TV, so that when you're getting any of these procedures done, it's done in a really nice environment. Essentially, other things that we do here is we're part of Allergan's Brilliant Distinctions program. It's now called ALLY. And what happens is you actually get points so that you can redeem those points for other Allergan products, whether it's skincare, Botox, or the Juvederm set of products. So when you're getting one treatment done, you're getting incentivized to save even more money on additional treatments. So let's talk about this Zimmer Z-Wave treatment. It initially was approved for the treatment of cellulite. And the reason it was approved for cellulite is because it produces a short-term increase of blood flow with an improvement of what we call angiogenesis, or new blood vessel formation, producing lymphatic drainage, as well as the mechanical and biochemical destruction of fat called lipolysis, and it relaxes the fibrous structures seen here in this cartoon, which then allows for the diminishing of cellulite. But what we have found is not only does it diminish the cellulite, but it helps to further destroy the fat cells. So once the fat cells have been cooled and really damaged, we do the Zimmer Z-Wave immediately after, and that further causes the destruction, which makes our CoolSculpting procedure work at least 2 to 3 times better than it would without the Z-Wave. This is just some of the patients that were initially treated with cellulite, showing that as we're getting rid of that lymphatic fluid, as we're getting rid or relaxing the fibrous bandings, we basically can significantly improve the appearance of cellulite. In studies that were done, you can see that you can get a mean decrease in the circumference of the thighs by using the Z-Wave technology. And we can use it with basically any type of procedure that we're doing, including when we do liposuction or liposculpture. So we tend to use our Z-Wave in order to make all of our procedures on body sculpting go even better. This is one of my friends, Chris Zachary. A long time ago, he actually showed the difference. This was just the CoolSculpting alone and CoolSculpting with the Z-Wave, showing the incredible improvement that the Z-Wave can provide. And we've now had over 10 published studies to basically prove that using the Z-Wave after CoolSculpting really works better. Well, I want to take a minute to basically share with you during these very difficult times of COVID, why you should feel incredibly safe coming to cosmetic laser dermatology. Even though we're a very large office with 6 physicians, 2 fellows, a physician assistant, over 40 nursing personnel, all of our staff is incredibly healthy. All of our staff get checked every single day, their temperatures as well as their history, to make sure that no one is sick in our office. All of our staff wears scrubs, washes their hands before and after seeing any patient. We all wear face masks, eye protection, and basically we make sure that we do everything possible to ensure the safety of not only ourselves and our staff, but our patients as well. One of the things that you'll notice when you come to our office, especially those that have come before, is we now have mandatory 6 feet spacing. So all of our desks and workstations are set apart so that we can ensure that no one is going to be in prolonged contact with either patients or our other staff. As you'll notice, when you call the office for an appointment, we do screen all of our patients, both on the phone as well as when you come to the office, with taking your temperature and making sure that you are healthy and you are not going to be able to infect anyone else in the office. If you don't have a mask, we provide masks for you. And we basically, even though we were really clean before, it's not like we were a dirty office. Now we're doing even more. It just comes to mind, I actually recently went to see my mother, who's 89, in Miami, and I've never been on a cleaner airplane. I always wondered, why wasn't it this clean before? Well, that's airplanes. Our office has always been incredibly clean, but now we're cleaning every single room after every single patient. And we've also decreased the number of patients we are seeing so that we can make sure that we have absolutely no waiting. You know, one of my pet peeves is we've never had a waiting room. It was always a reception area, but now we make sure that we never have more than 2 to 3 people in that large reception area, retail center that we have. We try to have our patients wait in their car, and we call them up when they're ready for their appointment so that we have no patients waiting. We also limit our interactions of all of the patients that come into our office. So we try to check you out in the room, and we have a variety of different ways that you can exit the office to ensure your safety and your well-being. So for those of you that have any fear of interacting with others, it is so much safer to be in our office than to go to a supermarket or a pharmacy or any of the other places that we have to go to these days. And now I want to turn this back to Risa to talk about who is going to win the exclusive specials that we have.
Great. So these are definitely the specials. So you guys can see them now, and make sure that you take advantage of coming into to see Leysin. Leysin is available for in-person consultations at our office and also for virtual consultations. So feel free to take advantage of whichever one you are most comfortable with. Let's see. Is there any more to the talk, or can we move on to the Q&A? Oh, a few more things. So I also just want to remind everyone that we do offer a number of financing options. Someone already, Marissa, you already asked a question about this. So we do have a financing options with Care Credit. They offer 0% interest for up to 12 months with payments as low as $300 per month or even less. So that's a great option. And how do you get in touch with us? So you can call us or text us. The phone number is up on the screen. We do have a number of physicians and staff members that speak Spanish, actually a lot. And let's see, we're located right off of Genesee, kind of at the, right at the 5805 split. And this is the rest of our contact info. So now, without further ado, I think we should move on to the Q&A portion because lots of people are already having questions for us. So I am going to remove the screen, if that's okay, so that we can see Dr. Goldman and Leysin larger here. All right, so at this point, thank you so much for tuning in. For those of you that would like to ask a question, please use the Q&A feature in Zoom. So here we go. If you continue with regular exercise program after the treatments, with the will the results be increased? And do you need to redo it months or years afterwards?
So the answer is we do encourage to maintain a healthy lifestyle after treatment. If you were to gain a significant amount of weight down the road, it's less inclined to go back to the areas that you treated with CoolSculpting and more inclined to go elsewhere. But we do encourage a healthy and active lifestyle after treatment.
Great. Here's a good one that you guys might have to answer together. But what are normally the deciding factors between using a non-invasive procedure like Cool3 or liposuction?
Well, it depends on what we actually would like to do. So when I have a patient that comes in and they need a variety of different areas treated, I always ask them, okay, how long do you want to wait to see the improvement? Do you want to do it in all one procedure, or do you want to do it in multiple procedures? And if someone says, you know, I can take my time and I can do it gradually and achieve my ideal body shape within 6 months, that's a definite CoolSculpting patient. But if someone is more likely to want to get it done in just one procedure and to try to get their ideal body shape within a few weeks, then we talk about liposculpture. And liposculpture that we do at Cosmetic Laser Dermatology is very different than the stuff that you see on TV, where they're putting people to sleep and they're using like a garden hose to suck fat out. You know, what we do is all of our patients are fully awake. during the procedure. Nobody feels any pain. We use teeny little cannulas the size of pencil lead to suck the fat out with, and there's virtually no stitches, no scarring from the procedure. I've actually had it done. And, you know, I tell the story a lot that when I had liposculpture done by one of my friends, I went out to dinner with them that evening. I did liposculpture on a patient the next day, and I did a 60-mile bike ride 2 days later. So really, liposculpture is not the same as it is in the movies. But again, if you want to take a little bit more time, if you just have very little areas to be done, CoolSculpting is an outstanding way to do that. Really, in our office, we probably do equal amounts of liposculpture and CoolSculpting. It really depends on what is best for you.
Yeah, thank you so much. And that's just another reason why so many people come to cosmetic laser dermatology, because you don't have to pick ahead of time. You could come in and Dr. Goldman and or Leysin can physically evaluate you and help you decide between all of the options that we have available. All right, so let's see, here's an easy one. Can you treat knees and ankles?
So knees, depending on, you know, the location of the stubborn pocket of fat, I would like to see it in person. Ankles, I typically do not recommend treating the ankles.
Yeah, you know, the fatty ankles we call cankles, and there we can do liposculpture on. It's a slightly more difficult procedure, but it's something that we have a lot of experience in doing over the last 30 years. So that can be done as well. See, with CoolSculpting, you actually have to physically grab and suck the fat into the cup. And so if you can't like grab and suck it in, then you need a different body sculpting.
Aren't we also doing Ulthera for saggy knees as well?
Yes, that would be a skin tightening procedure. So there's 3 different techniques that we use, actually 4 technically, for skin tightening. One, as Risa just said, is Ulthera, which is a focused ultrasound that helps to both dissolve or destroy fat as well as tighten the skin. The other is called thermage, which is a bulk radio frequency heating. The other is called thermi-tight, which is a, oh, I'm sorry to get you bored, Risa. Thermi-tight, which is a basically a little probe that we put in the skin to both tighten the skin as well as destroy the fat. And the fourth is radio frequency microneedling. So we have all 4 of those options in addition to CoolSculpting here at Cosmetic Laser Dermatology. And it's really our job as physicians and practitioners to help guide you through the course so that you can make the best decision on which treatment is best for you.
Great. Okay. Can Cool 3 help tighten loose skin post baby? I have extra fat, but also extra skin on my tummy.
Well, it's important to actually be seen by Leysin, myself, or one of our other physicians, because, you know, without actually seeing you, feeling your skin, pinching, it's very difficult for us to be able to guide you in what is the best treatment. And, you know, sometimes we actually need to do a mini abdominoplasty or a slight, very minor surgical procedure. So we have even that would be our 6th type of treatment that we have. So for questions like that, it's always best to actually come in, allow us to personally evaluate you, and we can again guide you through that process of choosing the procedure that's best for you.
Okay, great. Here's an easy one for Leysin. How many sessions of CoolSculpting do you normally recommend?
Usually it's around 2 to 3 treatments, depending on the area and the amount of fat that is there. I would say average 2 to 3 treatments.
All right. And one more, is the pricing based on the number of applications or the size of the area, or how do you price?
Our pricing is based on the size of the application that we use. So it's best to come in for a treatment plan, customizable to each and every patient. And then we can go through pricing as well.
Okay, perfect. All right. So what is the downtime for CoolSculpting if you get several areas treated at once?
Very easy to get several treatment areas at one time. Most patients are sore for about a week, like they've been to the gym and exercised real hard. But then there's a little bit of numbness afterwards for about 5 weeks. It's just a temporary loss of sensation to the area treated, but nothing that prevents you from your normal activities of life. You're able to go right out to exercise immediately after treatment. You can submerge in water. There's nothing you cannot do.
All right. So a couple questions now about cellulite, which I guess is a similar topic. So the first question is, does any of these treatments impact cellulite at all?
Well, as I said in our lecture, the Zimmer Z-Wave actually does interact with cellulite, but cellulite has been something that I've actually been working on for 25 years. I've actually published 2 textbooks on the treatment of cellulite, and there's many different treatments that we offer. One of the ways is called a cellulase, which is a laser treatment that we do in combination with liposculpture. Another is called sulfina, which is a way that we actually sever the fibrous bands producing cellulite. A newer technique that will actually be coming, it's already FDA approved, it'll be available in January, is called, I think it's called Quo, and it's from a company called Endo Pharmaceuticals. This was a project that I initiated, and it took 10 years to go through the FDA approval. And we will be the first office doing this procedure. It's a simple injection into the fibrous bands, which takes literally seconds and allows the cellulite to disappear. So there's many different ways to treat the cellulite. Again, it all depends on exactly what kind of cellulite you have. And so it's really best to come in for an evaluation.
Perfect. So I hope that answers your question too, Allison. She said, I do push-ups and a lot of arm weight work, but I have unsightly cellulite on my arms, so she doesn't want to wear short sleeves. So, all right. Let's see. This is an easy one, Leysin. What is a banana roll?
The banana roll is right underneath the tushy, right under the buttock. There's a little roll of fat that a lot of women don't like to see in their jeans. You can kind of see a little roll right under the buttock. So that is the banana roll.
Got it.
Yeah, interesting with the banana roll. If you try to treat that with liposculpture, sometimes it really doesn't work very well. And so CoolSculpting is a much safer way to treat it because there is a ligament there that actually holds the buttocks up. And if you destroy the ligament, it can make the buttocks go south. And so that's, before you're treating the banana roll, you want to go to an expert because sometimes the treatment is worse than the cure.
All right, here's some good questions about timing for these treatments. So Nancy says, does this work with uncontrollable weight gain from menopause? I'm 56 years old. I've gained 25 pounds and it's very hard to get rid of.
Well, as a guy, we go through something called menopause, and we develop these sort of like love handles, and it's the same kind of thing. And whether it's menopause or menopause, our bodies literally change after the age of 40. Everything sort of goes south, and so we can use things like CoolSculpting or Dermitite or Thermage or Ulthera. We can use a wide variety of treatments in order to get you back to that premenopausal body shape that you want.
Great. All right, and here's another one on the other side of the equation. So if I'm planning on getting pregnant in the next few years, would it still be worth it to deal with problem areas now, or should I wait until after I'm done having children?
Leysin, I'd like your comment as well, but the way I look at it, it's better to get things done when you want to get things done. Because when you get pregnant, it's not, let's pretend what your problem is saddlebags or love handles. So if we can make those even prettier for you before pregnancy, when you get pregnant, nothing's going to happen. It's not going to get any worse. The fat's going to redistribute throughout your body. So it really doesn't matter if it's before or after pregnancy. The only thing we wouldn't do is we wouldn't treat you during pregnancy. So during pregnancy is a time that you basically need to take care of yourself, and it's a time where we're not going to jeopardize in any possible way whatsoever anything going wrong with your beautiful baby that's developing in you. But before pregnancy or after, no problems whatsoever. Even if you're breastfeeding, you can have CoolSculpting done, because there's absolutely nothing that's going to harm the production of breast milk.
Anything to add to that, Leysin?
I agree 100%. I think when you're ready and when you're ready, you can do it anytime. You don't need to wait till after pregnancy. So I agree.
Yeah, I do as well. And I think both Leysin and I have kids, and we can say, you know, it's definitely harder after you have kids to get in better shape, and you don't have as much time to get into the office. So personally, I would say do as much as you can before, because it will be easier. All right. Do any of these procedures cause scar tissue internally?
You know, technically, the way we tighten skin is by forming internal scar tissue. But it's so minor. When I've actually done surgery on patients that have had any of the procedures we've spoken about, whether it's CoolSculpting, Ulthera, Thermage, ThermiTite, it's imperceptible. So there's no like adverse type of scar tissue that occurs internally. But you know, sometimes the doctors say it's a fibrotic response that causes the tissue tightening. And technically that is a scar tissue, but I have never seen it be a complication of any of these treatments.
Got it. Okay, and then there's a couple questions on pricing in here. You know, how much does lipo cost? And is there a price break for several areas of CoolSculpting at once? And I think the best answer is that we really customize the treatment based on you. So it's really hard if there's no like flat rate for liposuction, because it depends how many areas and how much we're doing. I do know we do offer promotions often in the office on CoolSculpting, and especially right now for those of you watching this webinar. So I encourage you to come in and see Leysin. The consults are complimentary, and then you can get a detailed, individualized quote for all the areas you want to do, and go over financing options. Okay, we have time for just a last few couple questions. So here's a good one. Can you do CoolSculpting on the front of the thighs, the quads, or use CoolTone on the front of the thighs to help with cellulite and lax skin of an older person?
You know, that's a good question. Again, when you think about CoolSculpting, it's what you can pinch. So most people don't have a pinchable, graspable type of fat on the anterior thighs. That's something where CoolTone works really well, because it's going to increase your muscle tone as well. It's something where the procedure we do called ThermiTite tends to work, as well as Thermage and Ulthera. But CoolSculpting, not so much, because it's really not a fat problem. Leysin, do you agree?
I agree. Yes, I would recommend CoolTone or one of the other procedures, Ulthera, ThermiTite, or Thermage.
Okay, great. All right. So very last question, and then we'll just go over the promotion one last time. So can CoolSculpting be used for the arms, and what's best for drooping skin above the underarm?
CoolSculpting can absolutely be used for the arms. It's a very nice area to it happens to be hyper responsive, as mentioned in the presentation earlier. You will get some tightening of the skin as well after the CoolSculpting. I would assess that 6 weeks after your treatment to see how much tightening you've gotten, and we can actually even consider adding in a skin tightening procedure. Again, either a ThermiTite, a Thermage, Ulthera, if necessary. It would be nice to have a nice complimentary consultation so that we can see the area and how much skin laxity there is to begin with, and then make a recommendation on that.
You know, I do recommend that all of you that have these questions, go to our website, clderm.com. You'll find that we have a lot of before and after pictures and videos showing the techniques that may be able to help guide you through the procedures. But again, as Leysin said, coming in for a personal consultation is probably the single best way to answer your question.
Absolutely. So again, thank you guys all for tuning in. We have a list of everyone that registered and in today, and we will be picking the winner of one cycle of CoolTone or CoolSculpting tomorrow. So we will be announcing that. And everyone who tuned into this webinar, you'll have access to our discounted Cool 3 pricing at $550 a cycle for CoolSculpting, which is valid through the end of the year. So to take advantage of that and to prove you saw this webinar, our secret word is inspire happiness. So just say you saw the webinar and you know the code inspire happiness, and you'll have an option to get that discounted rate. Someone is asking, what constitutes a cycle?
So a cycle is one application to an area. So it's best to come in for a consultation, and we can come up with a treatment plan, and a cycle would be considered one application.
So if you do the front of your tummy with one applicator, that would be one cycle.
Yes.
Okay.
Typically, you know, the lower abdomen would need either one or two applications to the lower abdomen.
Got it.
Mm-hmm.
There really is so much personalization and customization in this, and that's why we try and offer, you know, complimentary consultations. How will the winner be notified? We will announce on social media, but due to HIPAA, we will notify that patient specifically as well via email or phone if we have your phone number already. So thank you all again for tuning in. I really hope this was educational and you could learn about, you know, I know a lot of places advertise that they do CoolSculpting, but it really is not apples to apples. The way that we do it here at Cosmetic Laser Dermatology is very unique. First of all, because of our practitioners and the person applying the applicators like Leysin, but second of all, because of the proprietary combination treatment we're doing with CoolSculpting, CoolTone, and the Z-Wave. So if you live in Southern California, there's really no excuse not to come on in here to get treated, especially now that you know so much and we have the discounted pricing. And I really hope to see you all soon. And thank you again for joining us. And thank you so much, Dr. Goldman and Leysin, for your time today.
Thank you.
Bye-bye.
Bye.